So with this core exercise, we're going to be focusing on the muscles that are in the front of the core. We break our core down into front of the core, so anterior, posterior core, and then lateral core when we talk about working on stability and core muscle activation. So this is going to be focused on activating the front core muscles or anterior. And most often, I really want you to focus on, it's not a different muscle, but it's a different portion of the muscle, really low down, pretty much right above the pubic bone. So if you have your belly button and pubic bone, I want you to focus low down there in the muscle activation in that portion of the muscle in terms of what's working. So you're going to start on your back. And if you are someone that your chin tends to be reaching up to the ceiling naturally, I would recommend using a towel roll folded or a pillow so your head can be up here. What that head position will do is it'll take your ribs, which oftentimes can be when we're on our back, can be splayed upwards. And if we elevate the head, it just softens that rib cage down, and it takes a lot of strain off the low back. So it's definitely something worth trying if you feel like this causes pain in your low back. But I'm gonna just do it here for right now. So once you're there, you are going to inhale, let your belly fill and expand. Exhale, let those muscles lightly engage and create some tension low down right above your pubic bone. And I'm going to stabilize by pressing lightly one foot into the floor and then allowing the other leg to just rise up. And I'm really just allowing my hip in the front here to feel really relaxed. And this knee is relaxed too. I'm not holding it up like this because that is actually going to activate your quad muscle, and we're trying to take it out of the picture a lot of times at first. So just have that foot just be resting down, and then you bring this back down. Now, if you're doing this with the breath, if I've told you to do it with breath, it's going to look like this. You're going to inhale, you're going to exhale, and then when you start your exhale, when you're almost done, you're going to let that leg come up while you're holding those abdominals in. Everything is softening in the front of the hip. There's really not much work or tension being generated. Inhale, and then exhale as the leg comes back down. You have to think about your points, right? So you can have your hands as points and your feet are points, and you need to push into your points when you take one off to counter the momentum. Because if I just think about lifting, my whole pelvis is going to roll. And then when I do that, I'm going to be overworking my hip flexors. You want to try to maintain what we call a stable pelvis by using these cues of countering very little. I'm not like pressing really hard, but that is helping me create muscle activation all the way through my trunk. Again, these are tiny or relatively deep, like low grade activation. It's not a power move. It's not like gripping everything. It is just super subtle. And you're just trying to find that stability without using so much effort and overflow of a lot of muscles. A progression for this is to start to do the same thing, but you are going to let the knee go to 90 degrees. So if you notice, my foot is going up, and then you exhale on the way down. This a little bit harder. Float that leg up, almost like you're lifting the leg from the back, floating up, and that knee gets to 90 degrees. Okay, and you would repeat that perhaps 10 times.